Okay, good morning to everybody. I see we have 59 students, participants, I would say, attend these lectures. Okay, and what we are going to do today, we will discuss some problems related to the detection and prediction of outbreaks and pandemics, and then I will explain to you the architecture of streaming data that plays an immense role in confronting this problem in terms of detecting and processing data in real time. And we can do some exercises after the break. Okay, so the today lecture is can we make predictions about future infectious outbreaks and pandemics? I would like to say that an infectious disease actually can be defined as an illness due to a pathogen or its toxic product arising through transmission from an infected person or an infected animal, or actually a contaminated object of any nature to a susceptible host. Infectious diseases are responsible for an tragic global burden of disease that impacts public health and economies worldwide. I give you an example. Following the estimates of the World Health Organization, we have annually 50 million years lost due disabilities caused infectious diseases and over 10 million deaths. If you take just a typical year, and I'm not talking about now pandemic, but actually it is simple flu. It says every year more than 200,000 Americans are hospitalized for flu-related complications. And over the past 3 decades, there have been up to 50,000 flu-related deaths in the US only, according to the CDC. It is Center for Disease Control and Prevention. So, of course, young children, people, elderly people over age 65, pregnant women, and people with certain health conditions like asthma, diabetes, heart disease face a higher risk of flu-related complications, including pneumonia, ear and sinus infection, and bronchitis, for example. But if we go a little bit back in terms of pandemics. I would like just to give you some also numbers. You know, of course, that one of the deadliest pandemic that ever happened. It was the Spanish flu pandemic of 1918, 1919. It is ended in 1920. And the spread of this terrible pandemic was caused by troops that moved in during the World War I. And what happens, the spread was so fast that actually 500 million people across the globe were infected by the Spanish flu. And it caused, there is some controversy about how many people got killed by the Spanish flu pandemic. But I just look at this because I tried to model this dynamics of this pandemic a few years ago. And I think that the most reliable number would be about 100 million people died due to this virus. And in the United States alone, we lost 700,000, approximately 700,000 lives. So the toll was very, very high. Now, actually, in fact, more US soldiers died from the Spanish flu than were killed in the actions in the battle of war. So about 40% of the US Navy personnel were hit by the flu, and while 36% of the army became ill. And troops moving around the world in crowded ships and trains helped spread the killer virus. Okay. What happened is that the cause of this virus is still not so clear. But almost 90 years later, in 2008, researchers announced they had discovered what made the 1918 flu so deadly. So the nature was still not the origin of this. We're still contemplating, so it's not so clear. But the researchers found that a group of 3 genes enabled the virus to weaken a victim's bronchial tubes and lungs and clear the way for bacterial infection that caused pneumonia. Okay. So that was found out 90 years later. But our lectures, actually, we have a series of lectures on public health. Please send me questions to the chat, all right? Okay, so I don't want to interrupt the lecture. We will discuss it. So all questions, please send me to the chat, all right? So what we, this series of lectures are dedicated, they under public health informatics and technology. And actually, we found out that public health informatics and technology, we call it FIT as abbreviation, plays a very important role in detecting the pandemics and outbreaks, in to mitigate also this spread of virus and the consequences of virus. But actually, what we have to think when we talk about predictive power of public health informatics and technology is what actually we would like to predict. So this is a question quite important. So, for instance, in COVID-19, also outbreaks of monkeypox, polio, HIV, Ebola, avian influenza, and other diseases that exhaust global resources, especially in countries characterized by the lack of adequate preparedness. We understand that using this power of public health informatics and technology, we could significantly ease the consequences of the outbreaks and pandemics. And with the power, with our ability to predict, we can significantly turn around and solve many problems that would occur otherwise. So in the United States, we must be prepared for outbreaks and pandemics caused by various sources, including animal reservoirs. Why I'm telling you this? Because sometimes I'm a little bit also puzzled, because over 70% of infectious outbreaks originated from animal reservoirs. And by some reason, we separately look at the human reservoir and animal reservoir. So we need to combine also the study of pandemics or outbreaks in within animals, because animals define the vector in the outbreaks and pandemics in human in the population. So this will be important. And plus, I would like to say that also the risk of biological warfare grows in large proportion. So we have to also to confront these problems, and also we can do this using this power of public health informatics and technology. Okay, so I told you at the beginning that first we need to identify what actually we can predict. Okay, and we can predict four things. Four. Okay, the first one is we can estimate using our algorithms the probability. And what probability is? It's risk, right? So we will estimate the risk that a novel infection will appear in a given host population. So the probability that a novel infection will appear in a given host population. Okay. Second, what we can predict, how fast it will spread, also in a given host population. Number three, how many people will be affected. So this is a typical predictive analytics problem. And number four, it is how long will it last. So we have four predictors. We have four problems that we can solve using predictive analytics in public health informatics and technology. We also can do, and this is also another route of work, is we can also make estimate and quite accurate of what might happen if people are treated. Because in Spanish flu, there were not vaccines, there were no treatments, but now we have another domain of work. So we can predict what would happen to a specific population if people are treated, vaccinated, or quarantined to contain an epidemic, and how many, how selected, how quickly. See, so all these things we can do now. So I just repeat, it is four predictors. It is risk of a novel infection. Second, how fast it will spread, how many people will be affected, and how long will it last, these outbreaks or pandemics. This all falls in the category of prediction. Okay. Now, if you look at my previous lecture, we spoke about digital epidemiology, and I described what does it mean, epidemiological triad. So this a classic model of infectious disease causation. It is called the epidemiological triad. Envision that an infectious disease results from a combination of agent, or it is pathogen, host, and environmental factors. If you look at the board, whiteboard, you can see D, it is disease, H, host, E, environment, and this is a classical view. Okay, it's in a triad. But also, I always in my work, I also add SM. It is social media analytics. And today, after my lecture, we will talk about this in more details when I will discuss this architecture. So social media also plays an important role, and I always add SM to DHE. So it is classical triad, epidemiological, it is disease, host, environment, and I also add social media. Some, you can also just enclose this SM, add it to the D, But I try to separate it because it's a different way to collect the data and a different way to process the data compared to D, which is, let's say, syndromic surveillance or historical data collection. So that is what happens. And with this one, we always, this is a DHESM, generate us the data. And this is the kinds of, we have 4 kinds of data, DHE. And useful predictions of future disease risk still depend ultimately on the quality and the availability of input data. When we talk with epidemiologists and some data scientists working in public health, of course, they complain about data quality, and we have now some quite powerful algorithms that we can use to boost the data quality. Okay. For instance, we have methods that now fill the gaps. We eliminate noise in the data. We eliminate outliers, which is very important, of course. We standardize data or normalize the data, but also it is also important to bring it to a common standard format. And you remember, I urged you to use Pandas data frame, because Pandas data frame offers a very powerful and very rich library how you can work with, and therefore you can standardize the data format. So because we have 2 standardization, one is standardized data in terms of values, right, or normalized data, and another is standardization of a format. And then I ask to pay attention and to use Pandas data frame. Okay, one thing is also important is the data completeness. Okay, so the data completeness is very crucial, same as the data quality, because if we do not have complete data, we cannot use accurate prediction. So completeness of the data plays important. So you need to identify the sources that plays important role in your predictive model, because it depends from what you are doing. In some cases, it can be environmental data plays the most important role, or in some cases not. Okay, so that's what you have to understand, which kind of data you will use mostly in your predictive model. Because what you do, you need, of course, first identify what you want to identify the problem, then you build a model, and then you take the data, then it feeds in this model, and then you see whether your outcome corresponds to what you have. You have to test it, and then if you have errors, you have to do this work again. So it is iterative problem. Now, what I would like to say that I think it was we started 19, so it is 9 years ago. I worked on an HIV problem like global. We had a sizable grant, and we had various countries participated in this project. And what I found also that besides data quality, some countries were a little bit reluctant to share the data. So this also, so the data that we worked was quite silenced. Plus, we found the sentiment that some countries were quite reluctant to share the data, and this, of course, also affect the accuracy of prediction and accuracy of your algorithms, because this incompleteness of data come from these kind of laws that is different countries execute not to share or protect their data. Okay, that is what we have in public health informatics when we solve global problems of pandemics, for example. So it is data quality, data completeness, and also data sharing with participants or with other countries that work on the same problem. What I would like to talk about is this D first. It is disease. Okay, so surveillance data describes the distribution of syndromic surveillance, the distribution of infection in space and time. Yes. And also epidemiological data on the natural history of a disease. It is the course of the disease without treatment. So we have two types of data: historical, so there's the data that come historically from that describe this the epidemic and outbreaks, and also we have a newly collected data via the syndromic surveillance. This data can come from EHR, from different surveys, from HIE, and other resources like registries and so forth that come, for instance, the historical data. And we call it secondary data. And secondary data, they has some kind of limitation because usually historical data, they have like time lag, so it is kind of old data. So this is one of the shortcomings of secondary data in epidemiological work. And also, I would like to say that when we talk about data streaming, when we would like to tackle this problem with outbreaks and pandemic, here it is that what happened when I worked on this HIV project. And what happens is that we try to do this in real time, data processing and building this pipeline, multi-layer, let's say, doing this public health information architecture. But thing is that we found out that some data comes with delays, so that there's some delays in reporting. And this, of course, also a huge problem, and you have to take care of it. So you have delays of data, so that some data come at some time, and some data come with some delay because the delays of reporting, the sharing of the data. So that is also the problem that we faced, and we corrected this problem doing some additional work. So you have to be sure that you have this, you synchronize the data, because there is some delays can happen. Okay, now what about host age? A host, it is knowledge of host. It is the structure of the community. So host data, it is population structure in this, let's say, community or state. It includes age, sex, density, spatial distribution, and so forth. Okay, it is also, we put here, it is data from social determinant of health. So it's about demography, about different things like housing, income, and so forth, that things that affect the age. And also age is a movement. So we also would like to know how many people, let's say, they travel from one place to another, how they commute, where they, for example, if they work in Alabama or in Georgia, but they live in a different state. So they also have interstate traveling they have, or between different cities, and specifically international travels. So it is age movement, we call it. So we have age demography and age movement, very important features. So this is age data. And what about the environment? It is E. E is it's a climate change, for example. We have data that coming from air quality, We know how this it affects environment, also coming let's say from wastewater. It's also a very important factor, and other environmental factors. Examples include climate-related factors associated, for example, with African horse sickness outbreaks, also cholera and malaria infection. So climate change is an important and topical subject that we always include in this pipeline, in the stream, when we do this first layer ingestion. So this data come from these four sources. We synchronize the data, so it's another step that would be do via ingestion, and then we send it through the storage to the system engine. So the system streaming agent, actually, but we'll discuss it after this break. So let's go ahead. So now what actually we need? So advances in public health informatics and technology help develop new algorithms, including big data, real-time data processing. So what happened is that I would like just to say a few words. So when we talk about the data, let's say data coming from surveillance, syndromic surveillance D, or environment, or from host, and specifically from SM, from social media, that we use in building predictive models that we are going to discuss later, because I would like to dedicate the whole lecture on what modern approaches now we have in predictive modeling, because the accuracy actually is governed by the what kind of model you will choose. Yeah. So what happened is that we deal when we talk about outbreaks and pandemics, we deal with big data. So big data are characterized not only by the volumes, because sometimes clinical data or other data that we collect, let's say from registries, they have quite sizable sizes. But also big data is characterized by the velocity of acquisition. So with velocity that come to the ingestion layer. And this velocity is very high in public health when we talk about outbreaks and pandemic, and also other problems. We have also data. And there is some estimate that actually in healthcare and public health, from 80 to 85% of data are big data. Okay, because now we have IoT, we have now wearable devices and so forth. So this is, they generate lots of data and with high velocity. And the thing is that what we urgently need now, not only highly sophisticated algorithms that are quite different from what we had before. Okay, when we have some data static, they don't come too much data, and we can do anything we want. So in these cases, with streaming is different. And we need also, of course, to train students and you, for example, because my lectures in hands-on are focused on big data. So we will have all algorithms that we have now, including Kafka, for instance, and other things that you will be trained in hands-on how to work with streaming data. And this is very, very important, because I heard in many occasions that some trained students come to work in public health departments, public health agency, and they have difficulty to work with the data coming in, and they have fundamental knowledge, let's say, of statistics, how to process the data. And when they apply it to the streaming data, everything falls apart. Okay, so that is breaks down. You cannot use machine learning because machine learning, for example, regression algorithms, they minimize the cost function, and the cost function is actually in many cases is a variance. But when you have different data coming in, variance changes. So what you are going to minimize? Suppose you have 1, 2, 3 at triplet. So what is the average? It is 2. And variance, it is also 2. But then another moment or second, another triplet comes, -1, -2, -3. Now it is average becomes 0, but variance jumps to 14 plus 2. It is 28. Yeah, will be. So what you are going to minimize? So this machine learning won't work, conventional. Artificial intelligence algorithms, decision support system won't work, and so forth. So for this, we have now another type of data analytics, which we call stream analytics. This one, stream analytics, is here. So when after this, we call it a stream engine or stream processor. So this goes to stream analytics, and we have another algorithms that are able to process the data and send it to the decision support system that gives decision, that gives some advice, I would say that, to decision how to work with outbreaks and pandemics. Okay, so what I'm going to do now, I would like to finish. This is introduction to what we can do. Now we can have a break, and after that I will show you the data from all the sources, how to build a pipeline, how to use the stream analytics, which is a little bit different, and we will show you this algorithm for the decision support system based on stream analytics. All right, so see you in 10 minutes.